Okay, so let's begin with some of the basics of what we're going to cover, and I figure this is a great way to introduce the subject. Since we're now entering pathogenesis as well as immunology kind of put together, when we deal with life, unless you've taken something like A&P behind this, there's really two big things that people need to be concerned about. One of them is usually reproducing, which is kind of an easy way to talk about most life, but probably the next one is usually not dying. And so I figured I would bring up something that would remind you of this a little bit more often, and if it's not too soon for some of you guys. But what we're going to be dealing with this class is preservation of life based on avoiding disease. That's the biggest deal, right? And so one of the biggest references that I can give to you is how to relate it to something that you already do and take care of more than your own life. Is most life has a set of properties that define more or less kind of how to protect itself. And so just like a phone, more or less, certain properties of you are built in to not only recognize things, but also to cool themselves down so that you can prevent disease. So things like fevers and stuff like that. Afterward, we come with an extra layer of protection, and we usually cover that layer also to kind of keep things from getting in. I assume you get dressed sometimes. It also requires massive amounts of rest for you to be able to kind of recover. And unfortunately, because we've got our giant sacks of liquid, poking them usually makes us leak very quickly. So pretty much a lot of equivalent, right? However, one of those main properties is this basis of immunity. So that'll be our next topic, obviously. But the idea is simple, to kind of have something that is already built in that will protect us from the outside world. However, when that doesn't work, like some of my references apparently do, I have to definitely follow with some of you and give you some spoilers, right? And the idea here is to have something that protects you from disease, and when you can't do that, something that can intervene to protect you further. This is the concept of an acquired immunity, like a vaccine. That will be the main concept behind this, right? All right. So what is the main purpose behind your immune system, your immunology, is to be able to detect things more than anything else. And if you can detect them, to prevent them from getting in. If you can deflect them, if you can't, if they're going to get in, to defer them. And if you can't defer them, to destroy them. That's really kind of the process of everything that's going to be happening. However, unlike pretty much your liver or your brain, your immune system is really present everywhere. And it is kind of categorized into three separate kind of titles. We get them into two big groups, what we call specific versus non-specific. And the non-specific version comes in kind of the two subsets. And so again, once we get into the immunity portion, we'll discuss this a little bit further. Again, assuming that you've already seen this in A&P, and so you have some good background behind it, right? So the three main sets of defense that you're going to be having are from physical damage, substance damage or chemical damage, as well as some sort of biological damage, which is really where we're dealing in micro. We're really going to look at things trying to get in your body and then take over. Really, that's where we're going, right? Now, part of the discussion that I really wanted to have you guys, and again, feel free to contribute as you go, is that in order to truly define how to work with disease, or the concept of pathology and the study of it, is that currently in the status that we're going, as we're going through some of the fun things that are happening in life, is that healthcare as it is, not only is it limited, but it's not really fairly distributed all across the planet. Not everybody has access to these things. This is not meant to get political, it's just for you to understand that. And one of the biggest issues here is that because of these inequities, it's really difficult to understand how disease really works, especially where you need to spend your time and money behind it. And so for that, for us to be able to know where to invest most of our time, most of our research, most of our funds, we really need to be able to define diseases so we can categorize them. That's the principle of microbiology, right? So that's what we're going to deal with in this topic. So for this one in particular, it kind of combines together topic I, which is pathogenesis, with the immune system, which is topic J. And so topic I will deal with a little bit of the disease concept, introducing again our microbiome, and then dealing with disease, pathology, pathogenesis, and so on and so forth. And then topic J will then be your classic immunology, anything from all the three big forms of prevention or antagonism against infection, and then just dealing with the immune system itself. Should be more or less a little bit of a review, right? And so at the end, then we have a few sets of slides for you guys to just kind of have as references. All right. So again, this is not necessarily going to be part of the exam. This is more based on kind of your participation, your discussion of specifically how do you define the disease. And this is probably one of my most interesting portions in my lecture is what is a disease? How do you actually categorize what a disease is? And so most people kind of have very different perspectives behind it. When you ask somebody to define disease, most people kind of think of an idea of a cold or cancer or something of that sort, but it really doesn't give you a valid idea of what disease is. And that's kind of what we're going to be about now. Okay. So if we're going to define disease more than anything else, in order for us to understand healthcare, we first need to know what sick means so we can define what healthy means. It's an easier way to get to things. And so when you ask people what healthy means, if you're going to look up in a dictionary, for example, what you're seeing here is just a very simple classic definition, a state of being free from illness or injury. Fairly straightforward, very easy to kind of deal with that. And ironically though, or possibly even sadly, is the fact that the World Health Organization, the same one just telling you all these stories right now about disease, is that its definition of what healthy means hasn't changed for close to 70 years. So all it states is pretty much a state of complete physical and mental and social well-being. That's it. That is very, very vague, because when people deal with health, it's not necessarily just, oh, well, if I'm bleeding or anything like that. We really need to consider more or less kind of mental states, as kind of we're dealing with lately. But there's kind of a philosophical approach to that. And there's also a socioeconomical approach behind that. Ironically also, depending on who you talk to, if it's medicine versus biology, technically healthy also involves just not being dead as opposed to just being injured. So depends on who really approaches this, right? So when we talk about diseases, most people will just, again, refer to what has ailed you in the past, and you go, okay, that's what a disease really means. Interestingly enough, because we're a little bit on the privileged side, is that if you start studying what disease means in other places of the world, it really has an impact all across the board from every single type of spectrum. It varies between where you live, your culture, ethnicity, gender, all these things have different variations behind them. And so it becomes very difficult to say what disease is. And so as we start trying to become a little bit more specific about what disease really is, we start looking for terminology. And that's really what we're going to deal with. And I'm going to give you some definitions. So currently, most people can approach it as this kind of disorder that can be happening both as a physical or structural based disorder, but also in a more functional based for that particular host or organism. But it's not necessarily just based on some sort of injury. Keeping in mind that, again, most people want to say, well, they're sick. A lot of people forget to think about mental health, for example. And there's nothing better than to rely on really, really bad sets of gender-based or sex-based definitions of how disease is based, simply because somebody tells you, well, take it like a man or something like that, which really has no context within disease. If somebody falls and scrapes their knee, for example, it's really, really poor sets of definitions that have led to those beliefs. So we need to kind of steer away from those. So what we want to do is first define how disease works. Okay, so the first biggest contention here is it a state or is it a process? And so as we start approaching this, for those of you who remember your good old A&P, the first topic that you usually cover is homeostasis. And so homeostasis is this wonderful condition in which everything should be working, right? And then as we start trying to define disease, we can say, well, it's some sort of deviation from that. You're steering away from where things could be measured or typically observed. But what if you can't? Again, especially with healthcare and trying to define things that are more on the sociological versus mental health is, well, you can't necessarily observe that, nor can you measure it very well. And that still counts as a disease. So how do we define that? So we're going to have two big categories for this. The first one is when we define the concept of an illness. An illness is an experience, okay? This is something that's personal. This is not something that is not necessarily observable, okay? And it may accompany a type of disease, but you may not be able to kind of define it. So you can feel ill, but most people might not be able to tell. As opposed to, for example, something being a sickness, in which this is something clearly observable. You can observe it, people can see it. So, and that can be anything from you leaking out blood to a cut to you missing an arm, so on and so forth. That will be kind of falling under that category, okay? So we have to kind of define what we can see and measure versus what we can't. Both of those things still fall under a disease. So we have to be careful behind this. Now, to make it a little bit further, since you're dealing with homeostasis, is that this is not just, oh, it happened to you in this second, it actually happens throughout time. So what happens to your body, especially homeostatically speaking, is that your body's constantly fighting back. And so healthy, in this case, is not just, oh, I'm currently well right now. It's a constant process. It's an ability to ward off or to fight off these diseases, these illnesses, these sicknesses. So what is defined in there? Everybody learned that at homeostasis, as homeostasis, I'm sorry. And so the idea is if you get injured, if you are hurt, if you are ill, whichever term you want to work with right now, it's your body constantly fighting that away. So it is a process of adaptation. So health is not, oh, okay, I'm feeling okay right now. It's your body constantly maintaining homeostasis. So health is defined as an ability, not as a state. And sometimes after you're injured, after you're sick, you actually improve. Sometimes you don't. And so sometimes you achieve new states of homeostasis, something that was different than what was previously. And so this is called an allostatic state or allostasis. So anything from getting a scar after you get cut, for example, that's a new state in which your body is now considered to be healthy. So that's an allostatic state, right? And so the same idea behind, you burnt yourself touching a stove and you learn not to do that anymore. That's a new state of kind of preventing any type of disease or injury. Okay, so let's get into the definition portions, right? So since we're going to be studying this little by little, what we're going to get into is first making sure we're studying what disease is, right? So that's an entire field of pathology. Fairly straightforward. Pathology is the science of disease, fairly straight. Right? Now, what causes a disease falls under its own little field called etiology. And then from that, we also have how the disease progresses, how it develops. This is called pathogenesis. And then usually what ends up breaking down or something that falls apart within that host is referred to as its pathophysiology. And then remembering that health is this ability, this process, then that means the disease is defined as that impaired ability. Something happened to that process. And then ultimately, something that is able to cause that disease, that injury, that illness, that sickness, is what we define as being pathogenic or its pathogenicity. And then a term that you kind of have to be careful because the word virus is very close to this, is how bad or how strong or how intense does something cause that disease, and that's called its virulence. And it doesn't necessarily have anything to do with viruses. Be careful with how we use that terminology. Everybody okay here so far? Good. Excellent. Okay, so let's start off with where do these states of processes of health begin? The very first one actually starts off prior to your birth. And so in utero, believe it or not, you're kind of clean. You're relatively sterile without you being the dead one in this case, right? You pretty much have no microorganisms on you. And then right at birth, you kind of get slathered with your very first set of bacteria called a lactobacillus group that as you exit the vaginal canal itself, you kind of get coated with your mother's, your parents in this case, first set of organisms. And then after that, you start acquiring anywhere between billions and trillions of bacteria onto your body. Now, for those of you who remember lactobacillus is the same one that is involved in fermentation of dairy. This is your cheeses, your milks, all that good stuff too. So more or less what I kind of trying to relate to this is the assumption that once you're inside your mom, you're completely kind of clean and sterile, but right after you're getting out, you get kind of slathered with cheese whiz, and now you have your very first microorganism, right? Now, to further kind of define this, is that very first set of organisms that are landing on you have to stay. It can't just be, oh, you got coated with it and it falls off. So this is the premise of colonization, is that these organisms have to establish residence. Okay? And then more than anything else, for them to become your part of your microbiome, they can't cause you any disease. Remember, the definition of your microbiome are these things that are in or on you, okay? They're living perfectly fine without harm. Okay? So the first set of these are your classic microbiota, your microflora, however you want to call it. But there are some that are what we call transient. In this case, these are the ones that either change over time, as its name kind of implies, or you kind of acquire and sometimes lose, depending on how your growth proceeds. So, kind of as a reminder on how we kind of understand the microbiome, is that now that we know that more organisms are on us than anything else, right? And this idea that it probably composes more than 50% of your cells on you, we start kind of looking at the genome of that microbiome, known as the microbiome itself, is this idea that they probably contribute to your well-being as well, as they really do. And so their genetics plays a role as well. And probably the main one that we've been looking at more than anything else is the gut microbiome, the one that is inside your intestines. And so there's plenty of research now going out, more or less leading to what is present within your intestines, leading to cases of obesity, to the passage of age, in this case, and how fast you can age, to even to triggers of cancer. So your gut microbiome, more than anything else, plays a major role. Some people have correlated it and possibly even given causation to things like migraines and things like that. So with this idea in mind, the concept of what you eat influences your health, and as most of us can kind of almost deduce, is that people kind of abuse this concept and also try to take advantage of saying, well, by eating or consuming things like probiotics, it's actually meant to be healthy for you. Not forgetting that, remember that anytime you consume something, it has to make it inside your stomach, right? And your stomach pretty much kills everything before it gets anywhere else. So you consuming some probiotics from your yogurt really doesn't lead anywhere. So we need a little bit more research and probably stronger sets of food to be able to pull that off. Now, that being said, your microbiome, your normal flora, again, has to remain there. It has to not only colonize you, but not cause you disease. But more than anything else, one of the coolest benefits, as we learn in immunity, is that it also prevents anything else from landing on you and trying to harm you. This idea of I was there first, right? So by these organisms simply colonizing your system, they're living on you, they take up space, they're preventing anything else from taking up space in there. And some of the time, we actually get some benefits out of it. For example, some of them, simply from living there, exclude other ones from landing there. And other ones, for example, like Candida albicans, in this case a yeast, changes the pH of the environment. So by changing the pH, other organisms can't survive there. So pathogens, when they land, they just kind of die off because of the change pH. E. coli, specifically present inside your gut, produces this wonderful little toxin called bacteriocin, one of those plasmids that we had talked about in the past, that also kind of harms other organisms. So this guy comes prepared to kind of kill off anybody that tries and colonizes next to it. So these organisms, as we're going to start seeing a little bit further, also provides us with certain benefits. So here's where we're going to start kind of defining some of what we call microbial relationships with their hosts. And probably the term that often gets bastardized, unfortunately, is the term symbiosis, which doesn't really mean what most people think it means. So a symbiotic relationship means that there's at least two organisms or more in which at least one of them is benefiting. That's all a symbiotic relationship means. And the most basic one of them is called a commensal symbiotic relationship, in which one organism is receiving some sort of benefit, and the other one, nothing is really happening to it. No harm, no bad things. It's just neutral to it. Some of the examples that are common are the ones that are present in your eyes, like bacteria, that simply are kind of living in there and using some of the stuff that lands on you, and they're eating it, consuming it, and using it as energy without harming you at all. Certain versions that appear generally, or for example, in your ears, are mycobacteria, strains that again are there, consuming, getting some benefit, but you're not being harmed at all. So that's the most common one. It's called commensalism. However, probably the one that people mostly confuse with the term symbiosis is something called mutualism, in which here both organisms benefit from it. So not only the host, but also the organism that is colonizing. And again, most people, when they use this, especially in the media or in movies and things like that, go, oh, it's symbiotic. No, that's not really what it means. But they probably meant to say it's mutualistic, which means that both organisms are getting something out of that relationship. Classic case also is E. coli. Not only is it getting food as you consume it and you absorb it in your intestines, but E. coli also provides you with certain vitamins. So you get a little bit of some cofactors and it gets some food. So both organisms benefit from this case, right? And then we have a different type of symbiotic relationship that, again, most people don't associate, called a parasitic symbiotic relationship, in which one organism gets something out of it, but then the other one now gets the short end of the stick in this case, and something negative happens to them. Okay, so at the bottom we kind of have these summarized under commensalism, mutualism, and parasitism. So the examples that you have down there is staph epi, which is present on your skin, not doing really anything on you. E. coli, like we kind of just mentioned earlier, that you get something out of it. And then something like a virus that is normally out there trying to get you. Now, to kind of remind you again of these trillions of organisms present on you, they're all over the place. They're not just restricted to one specific area. They're present in virtually most of your skin, obviously, most of your epithelial areas, anything else, the ones that are exposed to the outside, so nose, ears, eyes, that kind of thing, right? And there are some that do have some small differences between certain sex traits. So some of them that are present vaginally versus testicularly and things like that. So there are some variations even in, for example, urinary tracts. So they're not necessarily perfectly the same. So there are small amounts of variations there too. Now, there is one last relationship that exists, which is referred to as an opportunistic relationship. And so this one, no longer does under symbiosis, is the idea of something that is pathogenic when given the chance. So the idea here is that it can be on you, not doing anything, minding its own little business, but then eventually it turns. It gets to grow a little bit more, it gets denied about a certain component, and then it can cause you some sort of harm. And this will really be influenced by where it is on the host, the amount of it that is present on the host itself, and more than anything else, how well your immune system is working. So the idea here is that if you're young, for example, and your immune system is not fully developed, certain things can become more pathogenic. Or also as you're aging and your immune system starts to kind of fade away, you're more at risk for these type of opportunistic infections. Now, going into the field of etiology, again, trying to understand or study what is causing a particular disease, how is it starting, we actually have a model that discusses this. And this is what we call a causation model that is referred to as a triad. And the idea here is that it involves three specific points of information. And this is the host itself that can become susceptible, the agent that is causing this, and notice that it doesn't say an organism, it can be an agent altogether. Okay, so this can be a rock, if you will. And then also this can be the environment itself. So the idea, this triad, as we're going to try and show you, is the relationship of all three, in which you have something, some sort of agent, that will obviously harm the host, but only if there's an environment that allows it. So this is something that, as obvious as that may seem, is kind of important to understand etiology, especially as we study these very, very interesting diseases that are out there. And so let me give you a very simple example. There's this wonderful little organism called the Ebola virus, right? Pretty much you've seen it from movies and read it somewhere, heard it in the news, that is extremely pathogenic. And then we have us that are extremely susceptible to it. But without an environment that brings us together, Ebola is not of no concern to us, right? So unless you're going to hang out in certain regions of Africa, for example, you're not in the same environment. So you really don't have anything to be concerned from Ebola, for example. However, if you have something like a classic bacterial infection, your good old flus or colds or something like that, well, now you're present in the same environment. So a different way to kind of see the triad, if you will, is kind of seeing it like a teeter-tot or like a seesaw or something like that, in which the environment has to be present first that brings you two together, and depending on which of the two, the agent or the host, are stronger, one will prevail and one will not. So, for example, the host has a strong immunity. In this case, the agent will really do anything to you, or in this case, if the agent is extremely pathogenic or virulent, for example, the host will usually succumb. But again, without the environment, this is not possible. This is something to understand in etiology, and this is one of the main reasons, for example, as a healthcare provider, that you usually ask, where have you been? What have you been doing? That's part of that study. That's part of what we're trying to understand here, is the environment that brought you or caused that agent to cause you harm. Now, in case you forgot, going back to very much day one when we talked about this, when we talked about Robert Koch, in this case, is this idea of Koch's postulates is literally what we still do to date, a little bit varied in this case, on this idea of how do we understand etiology, how do we study it, how do we figure out what caused the disease. And so for those of you who remember, the 4 to roughly 6 steps of Koch's postulates is this idea that if somebody presents a disease, an illness, or an injury, the idea would be to try and isolate something from it, observe it, usually pass it on to something that is healthy to see if they succumb to the same type of illness, injury, or disorder. And then, hypothetically speaking, we would isolate the next organism and compare the two to see if there's any relationship. Now, we can't really do that on humans in this case, but roughly what we end up doing is you go to the doctor, you go to a clinic, you go somewhere, and the very first thing, even though you might say, I hurt here and I don't feel well, the very first thing we do is usually try and ask a few questions of what have you been up to, but also draw some blood, take some urine samples, a skin sample, a throat swab, something so we can do exactly that. Figure out where have you been and what agent has come into contact with you. Now, mind you again that in order to perform this, you require a host. So things like leprosy, syphilis, and things like that, kind of hard to do. But more or less, any single time you go to the lab, somebody takes a little bit of a throat swab, a little sample of blood, they take it to their own lab, they grow it, they observe it, then they confirm roughly what Koch's postulates was suggesting. So that is kind of bringing Koch's postulates together. So let's take a quick pause over here and see if everybody's doing okay. Okay, So as we start kind of entering this idea of etiology and how to kind of diagnose certain things, we start introducing a very short version of our epidemiology portion of the lecture. And probably the most important of them all is how we use the definitions that pretty much everybody gets them wrong. This idea of the difference between a sign or a symptom. And most of the time when somebody asks you something about your health, saying, what are your symptoms? Probably the worst question to usually ask. Really, symptoms are things that you can't really measure. So symptoms are subjective. Examples that I can give you are you go to a doctor or you go to a healthcare provider and you say, hey, look, I have a headache. How do I know you have a headache? How do I measure that? You can tell me you have one, but I don't really know. As far as I know, you could be lying to me. And believe it or not, that actually happens in healthcare all the time. As opposed to what we call a sign. A sign is something that can be measured, something that is objective. Okay. So at that point in time, missing an ear, missing a leg, bleeding out from somewhere, those are things that you can measure. So a sign versus a symptom fits this category of what is objective versus what is subjective, what you can measure and what is pretty much only apparent to the patient itself. And this is something that you guys as healthcare providers eventually, especially if you're already in the field, will start using as you start kind of screening patients. For those of you who are participating, you can let me know. A very, very old process that you get trained in nursing school, most of you guys will undergo that, is something called a SOAP system, in which you start writing down things like what is subjective, what is objective, what are the actions that are occurring, and then a plan. That's what SOAP stands for. But because, again, a lot of the subjective side to this is very difficult to kind of really measure. Every person is relatively different. We've kind of developed a brand new system called FDAR, which stands for Focus, Data, Action, and Response, which again, the term data there is really the objective side of measuring signs as opposed to symptoms. So you showing up saying, look, I'm feeling tingly, doesn't really help me. So as a diagnosis-based kind of treatment concept, here we need to make sure what I can measure, what I can observe. Okay, so we'll start talking about these as we go. So back to this idea of being able to have something objective versus something being subjective. As we progress in healthcare, we're starting to kind of focus more on this concept of something that is measurable, something that you can see, something that you can observe, so that we can be more efficient at diagnosing. Now, there is such a thing that I just kind of add on the side over here. The concept is called a syndrome, in which rather than just saying reporting one thing, you report multiple of these signs or symptoms run together. The term syndrome literally means run together. And so a syndrome here is when you get multiple signs or symptoms running together as a way to diagnose it. Probably the most common one that everybody will hear in the field is something called metabolic syndrome, in which we use this as a way to diagnose certain and predict more than anything else certain healthcare issues with your heart, simply because of measurements like obesity, high or elevated blood pressure, certain types of hyperlipidemia is present, and so on and so forth. These are multiple things that can be observed or measured that ultimately lets us know that you're kind of shortening your life and you're much more likely to have a heart attack. So that's where that kind of goes. Now, going along again with the signs or symptoms is objective versus subjective is something that is popping up literally right now as we speak. This idea of what a quarantine is versus something that is called isolation. The terms are based again on signs or symptoms. When you can actually observe something that is observable, measurable, a sign, this is in the case in which you isolate somebody. You isolate people that demonstrate signs. However, when there are only symptoms, something that we can't quite define accurately, you can quarantine them. So you quarantine people that display symptoms and you isolate people that display signs. And we actually give them names, there's terms. people that are displaying these signs are called cases, and people that are reporting symptoms are called suspects. In other words, the kind of longer story of this is that patients that are displaying symptoms and are suspects of an illness, disease, or injury, and so on and so forth get quarantined, versus patients that clearly display signs are declared as cases, and those should be isolated. So, continuing with that, because we're going to expand upon it a little bit more, is that your signs and symptoms, as we're trying to be more objective rather than subjective behind what we're trying to go over here, is that we also want to focus on how the particular agent that is causing that illness, injury, disease, and so on and so forth can be measured. And so since this is microbiology, we're really kind of trying to deal with pathogens more than anything else. We're not kind of going to expand on the topic of falling over and breaking a bone or something like that. And this has to do with a term that is very, very kind of misused as well. So I'm going to give you some extra ones. They're not necessarily written here, so I definitely pay attention to the lecture and write these down. More than anything else is the concept of something called communicability, something that's communicable, right? And here, most of the time it's referring to, in our field, as something that can be spread, whether directly or indirectly, versus something that can't be, which becomes non-communicable. Okay? Now, the idea here is that we are going to be focusing in our field on things like vectors, toxins, and so on and so forth that can be communicable versus non-communicable. Hang on to that thought, okay? That has nothing to do with something being contagious, for example, which is what most people kind of relate to. So we'll come and define that in a moment. So for that, in our field, we have a better set of terminology. We use the term transmissibility, okay? And so this means something that can be passed on from one host to another host, or from some inanimate object to a host. I mean, this doesn't require something being alive at all, okay? And so usually we're referring to a pathogen, but this can also involve some of their toxins, so we'll get to that too, okay? Now, the term contagious, believe it or not, is more of a social term as well. And so people have probably heard the term, smile is contagious kind of thing, or yawning is contagious, and this idea that it can be passed on from person to person. But remember, there was no vector, there was no pathogen involved in there. So we have to be very careful here. A contagion, or something that is contagious, implies a host automatically. It involves a living thing. So here, something that is contagious is transmissibility from person to person, from living thing to living thing, host to host. In other words, your sofa is not contagious. Humans are contagious. Dogs are contagious. Your desk is not contagious. Okay? So same idea behind when we talked about disinfectants and antiseptics and things like that. A disinfectant is only used on an inanimate object, right? Versus an antiseptic is used on something that's alive. Here's the same concept. A contagion, something that is contagious, has to do with the things that are living, okay? Whereas something that is transmissible doesn't necessarily involve that. You can have something like Clostridium being transmitted from a piece of rusted metal. That is still transmissible, but that is not a contagious piece of metal. Humans are contagious, animals are contagious, living things are contagious, okay? So let's kind of start defining that. Now, the other piece behind this is, remember when we're talking about disease and illness and those definitions that we mentioned before, is that remember, not everybody that gets that is contagious and ultimately gets infected, which I'll define in a second, falls ill. Just because, literally like we're talking about right now, somebody can sneeze on you, right? They are technically contagious, and it lands on you, hits your face, goes into your eyes, goes into your nose, or whatever it is. It doesn't mean you're going to fall ill or get sick, okay? So that person can still be contagious, but that doesn't mean you get sick. So again, these are the things that we need to be very careful when we're talking about disease. So something that is highly contagious this case, okay? That means that it can be passed on from a person to another person. That doesn't mean that means that the other person gets sick automatically. Unfortunately, in this day and age, and especially in the news right now, when somebody talks about something being highly contagious, they're just automatically assuming that the other person is going to die. That is not true at all. Okay, contagious only talks about transmissibility from living thing to living thing. That's all it is. If it's highly contagious, that means it can be transmissible, or it transmits really, really fast or really, really efficient. Now, what is infectious? Now, this requires a pathogen. Okay, and infectious means that once it lands on you, it has to be able to colonize you. It has to be able to stay on you. Okay, and then automatically, it doesn't mean it causes disease either. Just because you're infected doesn't mean you display any signs or symptoms either. Think about most sexually transmitted infections. Most of these would be what you consider silent. HPV, for example, and herpes, some of them I should say, okay, are highly infective and highly transmissible, but nobody sees them, which is why 60 to 80% of our population can be reported as having these infections. So this is why we changed the term from sexually transmitted disease to sexually transmitted infection, because disease implies something that is observable. And not everybody that is infected shows a trait. Okay? So we have to be careful with how we use this terminology. So it gets a little confusing. Now, the other piece that we're going to add before we probably shut down today's lecture is the concept of occurrence. So how do you measure something that is actually happening? And so this is based on population and probability. The idea of somebody being infected and a measurable outcome of disease. And so we divide it into two big cases. And we'll probably resume this again in the next topic too, just for review, of the concept of how many new cases, for example, occur in a year. This is called an incidence. Okay? Whereas prevalence refers to how many cases are new that year plus how many already exist. So an example usually kind of helps out with this. Every year, we get hit by a standard good old cold flu type of thing. I'm not going to hate coronaviruses right now, right? And so your classic flu has an extremely high incidence. 3-4 times a year, we get all these seasons, and virtually everybody gets hit by some sort of cold or flu. However, every year, everybody gets over it within a couple of weeks. So most colds and flus have very low prevalence because they don't last more than that one occasion. They go away. Now we can talk about something like diabetes, which has a very low incidence. Not a lot of people are going diabetic every year. But since diabetes lasts virtually until you die, it has a very high prevalence. Every year, more cases keep on accumulating every year. And so to the point that it's a highly prevalent disease, but a fairly low incident disease. Well, that's kind of the variation. So we'll start kind of expanding upon this as we get to it next topic, next Monday for the class, okay? So we'll kind of pause it here, and I'll ask for any questions.